Good afternoon all. I am Dr. Fasila, Assistant Professor, Department of Pathology. In this class, I will be discussing embolism. Okay? This topic is a very important topic for you. It is actually a continuation of the previous class, that is thrombosis. So, this comes as a PA number, that is your competency number is 6.5, PA 6.5, that is define and describe embolism and its causes and common types. Okay. So, this is usually asked as an essay question. Okay. Long essay question. You may also get short answers and one words from this very important topic. So the specific learning objectives of today's class, we will be discussing the definition of embolism, we will be discussing causes of embolism, different common types of embolism, that means thromboembolism, cholesterol embolism, fat embolism, amniotic fluid embolism, air embolism, and the consequences of each will be discussed in detail. Okay. So the definition of embolism, that is, it is a detached intravascular solid, liquid or gaseous mass that is carried by the blood. Okay. It is carried by the blood to a site distant from its site of origin. And what happens to that site? It causes dysfunction or infarction to the site. Okay, so this is the definition of the embolism. It can be a detached, solid, gaseous or liquid mass and it is carried by the blood from its site of origin to a distant site where it causes dysfunction or infarction. Infarction means cell death. It is an ischemic type of coagulative necrosis. Okay. What are the different types? So, as we already told, it can be solid, liquid or gaseous, and whether association with the infection, it can be bland or infected form, and from the site of origin it can be cardiac, venous, arterial or lymphatic, and also based on its movement it can be paradoxical or retrograde. So, in majority of the cases, that means in 99% of the cases the emboli is a detached that is a dislodged thrombus. Okay. So, that is why it is known as thromboembolism. Okay. Then the other forms of emboli can be cholesterol, fat, bone marrow, air, nitrogen, amniotic fluid, tumor emboli, foreign body. So, these are the different forms of emboli and majority of the cases, that means 99% of the cases a thrombus is the major form of emboli. Now, the thromboembolism, the most common type is the pulmonary thromboembolism. You can see here the thrombus moving from the systemic veins reaches into the heart, right heart, and it reaches the pulmonary arterial tree where it closes the occlusion. So, mostly it arises from it is actually a fragmented thrombi from the DVTs. What is DVT? DVT is deep vein thrombosis. Okay. So, it arises from the DVTs of the major lower limb veins and it is carried through large channels and usually pass to the right heart, okay, and reaches the pulmonary vasculature where it get arrested. Okay. So, it arises mostly from the deep veins of the lung, that is popliteal, femoral and iliac veins. So, who all are at risk of developing pulmonary thromboembolism? So, in the previous class, that is the thrombosis, we have already learned the different hypercoagulable states can be genetic or acquired, and among the acquired risk factors, okay, acquired risk factors of hypercoagulability, these are the major risk factors. It can be like those who are having prolonged bed rest or immobilization, they are at risk of developing pulmonary thromboembolism, and surgery of legs, it is one of the risk factor, and severe trauma, congestive cardiac failure, oral contraceptives, some drugs are also can cause this thromboembolism. So, such drugs, one is the oral contraceptives with high estrogen and other thrombophilic states. Okay, so these are the different risk factors for developing pulmonary thromboembolism. Now, a saddle embolus, we call an embolus a saddle embolus when the thrombus obstructs the pulmonary bifurcation, that is arterial bifurcation, main arterial bifurcation it get obstructed, it is such an embolus is known as saddle embolus. So, this is a specimen where you can see, that is the postmortem specimen of lung, where you can see the clot obstructing the major vessel, major pulmonary arterial trunk. Okay, again you can see the thrombus, that is it is seen as It is seen as a dark brown hemorrhagic clot. It is obstructing the lower extremity. Arising from the lower extremity, where it causes obstruction to the pulmonary arterial branch. Now, paradoxical embolism, what is that? Actually, when from the systemic veins the embolus reaches into the right heart, okay, it enters into the pulmonary arterial trunk, okay. But when there is a ventricle or atrial septal defects, what happens to this embolus? It reaches again into the left atrium and it backs into the systemic veins, okay. So, such a movement of embolism is known as paradoxical embolism, okay. Now, the consequences of pulmonary thromboembolism, it depends on the size of the thrombus, major vessels which are obstructed, like if it is the main pulmonary artery, like a saddle embolus, it can cause sudden death, or it can cause right ventricular failure, that means acute cor pulmonale, and if it is small, medium sized and end arteries, it can cause hemorrhage, pulmonary infarction and organization resolution. You all remember the fate of a thrombus, no? It can propagate, it can embolize, it can organize and recanalization happen, and also it is dissolution. So, all these changes can happen to this embolus or thrombus also. Now, in this picture you can see the here you can see the main pulmonary arterial trunk is obstructed by an thrombus, okay. Now, here you can see a area of pulmonary infarct. It is a type of red infarction. You will learn the next class, okay. So, these topics are almost continuous topics: thrombosis, embolism and infarction. So, now, the next part of the thromboembolism is the systemic thromboembolism. What are the different sources of systemic thromboembolism? Majority of the cases, that is 80%, it arises from the intramural thrombi within the heart, okay. And in 20% of the cases, it can be a fragmented valvular vegetations, it can be aortic aneurysms, it can be ulcerated atheromatous plaque, and it can be a paradoxical emboli. Okay, we have already discussed what is paradoxical embolism. And where all it get arrested? It can be anywhere, like lower extremity is the most common area, and it can be brain, other organs like kidney, intestine, spleen. All these are the different sites of arrest in systemic thromboembolism. Now, with that we comes to the end of the pulmonary thromboembolism. Now, we will be discussing some clinical scenarios, okay, based on which you will be able to diagnose the clinical scenario, and we will be discussing the type of embolism associated, okay. So, let us see this case. It is a 51-year-old man, okay. So, he is treated for severe coronary artery narrowing, maybe because of the severe atherosclerosis, and it is the procedure done is balloon angioplasty. But what happened to him? He developed uncontrolled hypertension and oliguria 2 weeks later, okay. So, and its serum creatinine is RFT, that is serum creatinine level is 6.8, okay. So, what is the specimen, that is he was died then, and his autopsy specimen showing the blood vessels. You can see the blood vessel, thickened blood vessel, where within the lumen you can see the fibrin thrombi and associated with the multiple cleft like spaces, okay. These are the cholesterol clefts within the associated with the fibrin thrombi, okay. So, what is the case? What is the diagnosis? It is a case of cholesterol embolism. Usually, it arises spontaneously in severe atherosclerosis, or it can be associated with some invasive procedures like arterial procedures like angioplasty. Okay. So, how is the patient presenting? He will be having renal function, worsening of the renal function, hypertension, distal ischemia, or it can also affect multi-system. It can cause acute multi-system dysfunction. Okay. So, that is about the cholesterol embolism. Most commonly, it arises from the atherosclerotic plaques, if it is by spontaneously, or it can be associated with some invasive procedures. Okay. So, that is about the cholesterol embolism. Now, the next clinical scenario, he is a 26-year-old male, okay. He is having a motorbike accident and is having sustained with severe injuries, okay, severe injuries with multiple long bone fractures, okay. So, now he developed shortness of breath and became comatose. Okay, he is having respiratory distress and now he is in coma state, and that is 3 days after admission. He died soon after and autopsy was done. Okay. So, let us see what is the autopsy and what are his clinical findings. Okay. So, what is there in his body? These types of rashes are known as petechial rashes. Okay. His whole body was showing petechial rashes, and his autopsy specimen of the brain is showing the multiple purpuric areas, that is brain purpura. This is known as brain purpura. Okay. So, his body is having petechial rashes and the brain is showing brain purpura. And the autopsy specimen of the section of the lung, you can see the congested lung alveoli, and so here you can see the capillaries filled with some fat globules, rounded structures without any stain taken. These are the fat globules. Okay, now the fat globules obstructing small capillaries within the lungs. Okay, that is the major finding. Okay, so the usually the fat globules are not taking stain in a normal H&E section because it is lost during the processing, and special stain can be done, that is a Sudan black that will stain the fat droplets. Okay. Now, this is a case of a fat embolism. So, you got it. It is a severe motorbike accident causing severe long bone injuries, and the H&E section showing fat globules and special stain demonstrated and confirmed the fat. Okay, so, this case is a classical case scenario of fat embolism. Now, what is fat embolism? It is obstruction of arterioles and capillaries by fat globules. Okay, what are the causes? It can be, majority of the cases it is due to long bone fractures. Rarely it can be from trauma to soft tissues associated with the burns, diabetes, fatty liver and pancreatitis. Okay, so that is about the fat embolism. Now, when it is called fat embolism syndrome, because when the patients are symptomatic, it can be mainly respiratory distress from the pulmonary insufficiency, or it can be when it is systemic, it can produce neurological symptoms, as in our patient that he has having coma. Okay, and anemia and thrombocytopenia. Thrombocytopenia is a cause for developing these skin rashes. Okay. So, that was about the fat embolism. So, we have already covered thromboembolism, cholesterol embolism and the fat embolism. Now, we will look into another clinical scenario. Here she is a 40-year-old female G2P1, that is gravida 2 para 1 and 39 weeks of gestation. Now, what is her complaint? She is admitted for ruptured membranes and thought to be in early labor. Okay. So, 1 hour later what happened? There is saturation fall, hypotension and emergency C-section was cesarean section was performed. Okay. So, and after extubation BP dropped to 60/40 and there is also bleeding from multiple sites like vagina, the incision that is C-section site and as well as the venipuncture sites. Okay. So, this is a case of a female, she is in labor, she is having a ruptured membrane. She presented with the ruptured membranes and she is in labor. She was in labor, but associated with the dyspnea, difficulty in breathing, saturation fall, hypotension, okay, and bleeding from multiple sides. So, what is the diagnosis? Pregnant lady presenting with this type of clinical features, or after, that is because associated with the ruptured membrane, what is the clinical diagnosis? This is the case of amniotic fluid embolism. So, autopsy, she died, okay, and it is because it is the mortality rate is very high. You can see mortality rate is as high as 85%. Okay. So, amniotic fluid embolism, and in the sections you can see the autopsy specimen of lung showing the pulmonary capillaries or arterioles showing. Here you can see this, it is associated with the fibrin thrombi and the laminated swirls of fetal cells. It is a squamous cells of fetus obstructing the small capillaries of the lung. Okay. So, it can be amniotic fluid, fetal cells, hair, other debris that is entering the maternal circulation. It is a very rare obstetric complication and the mortality rate is as high as 85%. Incidence is very low. It is very rare because it happens 1 in 20,000 to 1 in 80,000 of the deliveries, and it constitutes 10% of the maternal death. Okay. So, amniotic fluid embolism is a very important topic for you, and it can be asked as a short note. Okay. time of event can be during labor, as in our case during cesarean section, and after even after normal vaginal delivery, and it can occur as late as 48 hours following a delivery. Okay, so it is a very rare cause of maternal death. Clinical features, as in our case, the respiratory distress, cardiovascular collapse, cardiogenic shock, hemorrhage, cyanosis and coma. Okay. What are the prerequisites? So, in our case the patient had a ruptured membrane. Similarly, it can be ruptured uterine or cervical veins. Okay. Somehow this amniotic fluid enters into the maternal circulation. It can be through rupture of membranes, it can be through rupture of cervical and uterine veins, or the pressure gradient from uterus to veins. Okay. DIC, that is disseminated intravascular coagulation, develops because the amniotic fluid has a procoagulant action. Okay. And also it can cause anaphylactic reaction. So, that is about the amniotic fluid embolism. Now, the next clinical scenario, this is about a 62-year-old male. Okay. What happened to him? Let us see. He is having a surgery for right CP angle tumor, and neurosurgical procedure was done in this patient in sitting position. Okay, it was done in sitting position. So, near the end of the surgery, the surgeon removed he removed the retractor. There was a sudden shooting of the BP to 220 to 110, and with the tachycardia and increase in sound of the Doppler. Okay. So, instantaneously he had massive brain edema and even the cerebellar tonsil herniated out. Okay. So, what is this clinical scenario indicating? And his brain, so he also died, and his brain autopsy showing the cerebral vessels showing air bubbles, bubbling of air. Okay, you can see the cerebral vessels with the air bubbles. So, what is this case? This is a case of air embolism. Okay, so the gas embolism can be air embolism or decompression sickness, and air embolism can be venous air embolism. Okay, mostly it is a venous air embolism. Usually it is associated with the neurosurgical procedures, or it can be orthopedic, obstetric or cardiovascular procedures. So, it follows the some surgical procedures. Okay. Now, it can also be associated with chest trauma, abdominal trauma, or some craniofacial injuries, and also some catheterization to internal jugular and subclavian veins also can cause this air embolism, or sometimes long-term central catheters can also cause this type of embolism. So, it is a venous air embolism. This case is a venous air embolism. What are the symptoms? Patient will present with dyspnea, chest pain, tachycardia, hypotension, altered sensorium, and he will be in circulatory or shock, and he will be having sudden death. Okay. Now, that was about the venous air embolism. So, air embolism can be venous air embolism, or it can be decompression sickness. Okay. So, decompression sickness occurs in deep sea and scuba divers. Okay. What happens when these divers, when dives into the deep sea, they are breathing at a high pressure. Okay. Mainly they are breathed at high pressure with increased amounts of gas, that is nitrogen. Okay. And it becomes dissolved in their blood and tissues. But when the rapid ascent occurs, what happens to this dissolved nitrogen? It is bubbling out into the circulation. Okay. So, that is what is happening in the decompression sickness. Okay. Nitrogen bubbles into the circulation. This results in tissue ischemia or infarction. Okay, that is about the decompression sickness. What are the symptoms? Or the patient will be having severe respiratory distress, it is also known as CHOCS, and he will be having acute muscular and joint pain, that is known as BENS. Okay, BENDS, BENS. Okay, and it is also associated with the disorientation. CHOCS, BENS and disorientation are the major clinical features of the decompression sickness. Now, what is casein disease? It is actually a chronic form of decompression sickness where you can see multiple bone infarcts, okay, especially the long bones like head of femur, tibia and humerus, okay, where you will see multiple bone infarcts. So, casein disease is also a form of decompression sickness. It is a chronic form of decompression sickness. It is a part of decompression sickness only. So, you may get one mark questions from this area. Now, with this explaining all these embolism, we are going to conclude the today's session, and we have learned the embolism definition, we have covered the types of embolism and consequences of each embolism, and I have already reminded you that you can get long essays from this topic. It is a very important topic from hemodynamics chapter. So, let us summarize today's session. So, embolus is a solid, liquid or gaseous mass carried by the blood to a site distant from its origin, mostly are dislodged thrombi. Okay, it can be pulmonary emboli or systemic emboli, and pulmonary emboli, it is arising from the lower extremity DVT, and it is the effects are mainly based on its size and which vessel it is occluding, and it consequences can be right sided heart failure, pulmonary hemorrhage, pulmonary infarction or sudden death, and systemic emboli arising mainly from the cardiac mural or valvular thrombi, aortic aneurysm, atherosclerotic plaque, all these can be the sources for systemic emboli. Okay, and these emboli can cause infarction or ischemic type of coagulative necrosis to the organ affected. Okay. Now, fat embolism usually after bike accident or accidents causing severe long bone injuries, long bone fractures, and it results in pulmonary insufficiency and neurological damage. Amniotic fluid is a very rare cause of maternal death, and mortality rate is as high as 85%. It is following childbirth and can give to fatal pulmonary and cerebral manifestations. Air embolism occur upon rapid decompression, most commonly in divers, or it can follow some neurosurgical procedures, especially done in a sitting position, and in the decompression sickness it is due to the sudden bubbling of the nitrogen. Okay. So, thank you all, and please read the topic very well because it is a very important topic from your exam point of view. Okay. Thank you.